The fourth aspect of facial aging is volume change of the face, and that's loss of fat or bone as we age. Typically, the fat is lost on the cheeks and temples, and the bone is lost or absorbed around the orbits of the eye as well as the cheekbone. As you lose this volume, these areas start sinking in, and you start looking like a skeleton. And you don't want to look like a skeleton because that looks old. Therefore, in our assessment with you, we look for these losses and imbalances of the face. When you're younger, the face has more of a heart shape, where the cheeks are fuller in the upper areas and is thinner towards the lower face. But as we age, these proportions change and the face drops down to a triangular shape with more weight on the lower face. So we always recommend making sure that we correct the sunken areas that are most obvious at the upper cheeks and temples. Only after these areas are corrected first should the lower areas be addressed, such as these nasolabial folds. Many providers make the mistake of treating the nasolabial folds first, and this creates a heavy lower face or even a snout type of appearance on the face. Now, this is wrong because while it may hide a line, it's not acknowledging the full effects of aging on the patient's face, and then it doesn't look natural or attractive. Often, just doing the correct filling on the upper cheeks and temples helps to lift and resolve the nasolabial folds or reduces the amount of fillers needed there. Fillers or fat transfer is a valuable part of facial rejuvenation if approached with the proper philosophy. So if you have any questions about fillers or fat transfer, please reach out.